We continue our discussion on concussion awareness, and Dr. Jacob Kitchener joins me again to discuss what are delayed concussions, because we know concussions can happen right away, but a delayed concussion is something that can sneak up on someone, and it's something that parents should look out for as well.
Yes, some of the symptoms of concussion actually do not develop right immediately on the sideline or in the game. So some things that can develop over time, within the first 24 hours, loss of balance, and then beyond that they'll have certain memory and concentration issues. There are certain red flags that do happen within a few hours that if they happen, the person should be transported to the hospital. So if they suddenly develop loss of consciousness, they're awake, and then later on they lose consciousness, start to vomit, or their personality and behavioral changes, they become agitated. This could be even beyond a concussion. There could be bleeding in the brain, which sometimes becomes delayed.
So when you're seeking medical attention, what are some of the things, doctor, that you're looking for when someone could be dealing with concussion issues?
The things that are red flags are, again, problems with balance, personality changes, problems with their sleep cycles. These are things that are very worrisome, and they could lead to something that's even more dangerous than concussion. A concussion is considered a mild form of traumatic brain injury. Things that can be more worrisome are things that cause pressure in the brain or bleeding.
And if someone is diagnosed as concussed, what's the next step?
They don't go back in the game, and in general you avoid any kind of heavy physical activity until their symptoms resolve. It's okay to have some light activity as long as it's not what actually bothers them. So sometimes for a child we may say, okay, they can go back to school, but if they're having noise sensitivity, avoid the cafeteria, avoid music class, things like that.
And I know we only have a couple of seconds left, but just wanted to ask you this. As far as concussions go, we're still learning about them, are we not?
Very much. And interesting fact that a lot of people don't realize, helmets do not prevent concussion. We oftentimes think that they prevent concussions, but a lot of concussions is the whiplash injury. We don't have a way to mitigate those.
Doctor, appreciate your time as always, and of course there you know more about concussions.